Could a common vitamin be the key to reversing kidney damage? This question captures the growing curiosity around natural remedies and their potential impact on serious health conditions, such as chronic kidney disease, CKD. Kidney health is of paramount importance, as these vital organs are responsible for filtering toxins, balancing electrolytes, and regulating blood pressure. When kidney function is compromised, the consequences can be severe, leading to the accumulation of waste in the body, and in extreme cases, kidney failure. As more people seek natural and preventative approaches to maintaining health, vitamin E has garnered attention for its potential to protect and heal the kidneys. Known for its powerful antioxidant properties, vitamin E is believed to combat oxidative stress, a major contributor to kidney damage. The purpose of this discussion is to delve into what scientific research reveals about vitamin E's role in kidney health. We'll explore whether this vitamin can truly reverse kidney damage and examine the evidence supporting its effectiveness, providing a comprehensive understanding of its potential benefits and limitations. The kidneys are essential organs that perform several vital functions necessary for maintaining overall health. Primarily, they act as the body's natural filtration system, continuously filtering the blood to remove waste products, toxins, and excess fluids. These waste products and fluids are then excreted from the body in the form of urine. In addition to filtration, the kidneys play a critical role in regulating the body's fluid balance, ensuring that the right amount of water is retained or excreted. They also manage electrolyte levels, such as sodium, potassium, and calcium, which are crucial for nerve function, muscle contraction, and other bodily processes. Another key function of the kidneys is the regulation of blood pressure through the renin-angiotensin-aldosterone system, which controls blood vessel constriction and fluid retention. The kidneys also produce hormones that stimulate red blood cell production and activate vitamin D, which is necessary for bone health. Kidney damage can occur due to various underlying causes, with some of the most common being chronic conditions like diabetes and high blood pressure. Diabetes can lead to kidney damage through high blood sugar levels, which over time can damage the blood vessels in the kidneys, reducing their ability to filter waste effectively. High blood pressure similarly causes damage by exerting excessive force on the blood vessels, leading to scarring and reduced kidney function. Chronic kidney disease, CKD, itself is both a cause and consequence of ongoing kidney damage, often resulting from these underlying conditions. Another significant factor in kidney damage is oxidative stress, which occurs when there is an imbalance between free radicals and antioxidants in the body. This imbalance leads to the degradation of cells, including those in the kidneys, further exacerbating kidney disease. The symptoms of kidney damage can be subtle initially but become more pronounced as the condition worsens. Common symptoms include persistent fatigue, as the kidneys are no longer able to filter out toxins effectively, leading to a buildup that causes tiredness. Swelling, particularly in the legs, ankles, and feet, occurs due to fluid retention when the kidneys fail to remove excess fluids. Changes in urine output are also a key symptom, with individuals experiencing either a decrease or an increase in urination, or noticing that their urine appears foamy, dark, or contains blood. As kidney damage progresses without intervention, it can lead to severe consequences, such as kidney failure. In kidney failure, the kidneys lose nearly all their ability to function, necessitating dialysis or a kidney transplant to maintain life. Early detection and management of kidney damage are therefore crucial to prevent these serious outcomes. Vitamin E is a group of fat-soluble compounds that function primarily as antioxidants, protecting cells from oxidative damage caused by free radicals. These compounds are classified into two main categories, tocopherols and tocotrienols. Each category includes 4 different forms, known as alpha, beta, gamma, and delta, making a total of 8 distinct forms of vitamin E. Among these, alpha tocopherol is the most biologically active form in humans and is often the focus of research and supplementation. Chemically, vitamin E is composed of a chromanol ring and a long saturated or unsaturated side chain, which allows it to integrate into cell membranes where it exerts its protective effects. The antioxidant properties of vitamin E are particularly important in preventing the oxidation of lipids within cell membranes, thus safeguarding cells from damage that could lead to chronic diseases, including those affecting the heart, brain, and kidneys. While tocopherols have been more extensively studied, tocotrienols are gaining attention for their potential unique health benefits, including their stronger antioxidant activity and potential in reducing inflammation. Vitamin E is naturally found in various foods, such as vegetable oils, nuts, seeds, and green leafy vegetables, and it is also available in supplement form, often as alpha-tocopherol. The diverse forms of vitamin E and its essential role in protecting cellular health make it a vital nutrient in the human diet. Vitamin E plays a crucial role in the body, primarily due to its powerful antioxidant properties. As an antioxidant, vitamin E protects cells from oxidative stress, a harmful process that occurs when there is an imbalance between free radicals, unstable molecules that can damage cells, and antioxidants in the body. Free radicals are produced naturally during metabolism, but can also be introduced through external factors like pollution, smoking, and exposure to UV radiation. If left unchecked, these free radicals can cause oxidative damage to cellular components such as lipids, proteins, and DNA, leading to a range of chronic diseases, including cardiovascular disease, cancer, and neurodegenerative disorders. Vitamin E helps to neutralize free radicals by donating an electron, thereby preventing them from causing cellular damage. This protective effect is particularly important in cell membranes, where vitamin E resides and prevents the oxidation of polyunsaturated fatty acids, which are essential for maintaining membrane integrity. By preserving the structural and functional integrity of cell membranes, vitamin E plays a key role in maintaining the health of various organs and tissues, including the skin, eyes, and brain. In addition to its antioxidant function, vitamin E supports the immune system. It enhances the body's defense mechanisms by promoting the activity of immune cells, such as T cells, which are crucial for fighting infections. Vitamin E also influences the production of signaling molecules like cytokines, which help regulate immune responses. This immune-boosting effect is particularly beneficial in older adults, who may experience a decline in immune function as they age. Overall, vitamin E's dual role as an antioxidant and immune supporter makes it an essential nutrient for maintaining overall health and preventing the onset of chronic diseases. Its ability to protect against oxidative stress and bolster the immune system underscores its importance in a balanced diet, contributing to long-term well-being and resilience against various health challenges. Vitamin E is naturally found in a variety of foods, making it accessible through a balanced diet rich in whole, unprocessed foods. One of the best sources of vitamin E is nuts, particularly almonds, which are packed with this essential nutrient. Just a handful of almonds can provide a significant portion of the recommended daily intake. Seeds such as sunflower seeds are also excellent sources of vitamin E, offering a convenient and nutrient-dense option that can be easily incorporated into meals or eaten as a snack. Green leafy vegetables like spinach are another valuable source of vitamin E. Spinach is not only rich in this vitamin, but also provides a wealth of other nutrients, making it a highly beneficial addition to a healthy diet. Other vegetables, such as broccoli and asparagus, also contribute to vitamin E intake, although in smaller amounts compared to nuts and seeds. Vegetable oils, especially those like wheat germ oil, sunflower oil, and safflower oil, are among the most concentrated sources of vitamin E. These oils can be used in cooking or as a base for salad dressings, providing an easy way to boost vitamin E intake. However, it's important to use these oils in moderation due to their high calorie content. For individuals who may not get enough vitamin E through their diet, supplements are available in various forms, including capsules, tablets, and liquid extracts. These supplements typically contain alpha-tocopherol, the most active form of vitamin E in the body, and are available in both natural and synthetic forms. The natural form of vitamin E, often labeled as dalpha-tocopherol on supplement bottles, is generally more effective than the synthetic form, labeled as dull alpha-tocopherol. However, before starting any supplement, it is advisable to consult with a healthcare provider, as excessive intake of vitamin E supplements can lead to adverse effects, particularly in high doses. Incorporating these natural sources of vitamin E into a daily diet can help ensure adequate intake of this vital nutrient, supporting overall health and protecting against oxidative stress. Vitamin E is widely recognized for its potent antioxidant properties, which play a crucial role in protecting the kidneys from oxidative damage, a significant factor in the development and progression of kidney disease. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body, leading to the degradation of cells and tissues. In the kidneys, this oxidative damage can impair the function of nephron cells, which are responsible for filtering waste from the blood. Over time, this damage can contribute to chronic kidney disease, CKD, and exacerbate existing kidney conditions. Vitamin E, being a fat-soluble antioxidant, integrates into cell membranes where it neutralizes free radicals, thereby preventing them from attacking and damaging these vital cellular components. By protecting the kidneys at the cellular level, vitamin E may help slow the progression of kidney disease and maintain overall kidney health. In addition to its antioxidant capabilities, vitamin E also exhibits anti-inflammatory effects, which are particularly beneficial in the context of kidney health. Chronic inflammation is a common underlying factor in many kidney diseases, contributing to the gradual deterioration of kidney function. Inflammatory processes can lead to fibrosis, scarring of kidney tissue, and further loss of function. Vitamin E helps to mitigate this inflammatory response by inhibiting the production of pro-inflammatory cytokines and reducing oxidative stress-induced inflammation. This dual action, reducing both oxidative stress and inflammation, makes vitamin E a valuable nutrient in managing and potentially reversing kidney damage. By lowering inflammation, vitamin E not only protects the kidneys from immediate harm, but also helps to preserve kidney function over the long term. Scientific research has increasingly focused on understanding the effects of vitamin E on kidney health, particularly in patients with CKD or those at risk of kidney damage. Several studies have highlighted the potential benefits of vitamin E supplementation in improving kidney function and slowing disease progression. For example, clinical trials have demonstrated that vitamin E can reduce proteinuria, a condition where excess protein is found in the urine, which is a common marker of kidney damage. In patients with diabetic nephropathy, a specific type of kidney disease caused by diabetes, vitamin E supplementation has been shown to improve markers of oxidative stress and reduce the progression of kidney damage. Other studies have explored the potential of vitamin E to improve glomerular filtration rate, GFR, a key indicator of kidney function in patients with CKD. While the results of these studies are promising, it is important to note that the research is still evolving, and more large-scale, long-term trials are needed to fully establish the efficacy and safety of vitamin E supplementation in kidney disease. Nonetheless, the existing evidence suggests that vitamin E holds potential as a supportive therapy in the management of kidney health, particularly when used in conjunction with other treatments and lifestyle modifications. Animal studies have provided valuable insights into the potential benefits of vitamin E in preventing or reversing kidney damage. These studies often serve as the initial step in understanding how vitamin E might work in the human body, offering clues about its mechanisms and effectiveness. In various experiments conducted on animal models, particularly rodents, researchers have explored how vitamin E supplementation impacts kidney health, especially in the context of oxidative stress and kidney injury. One significant finding from animal studies is the role of vitamin E in reducing oxidative stress, a critical factor in the development of kidney damage. For instance, in studies where animals were subjected to conditions that typically induce oxidative stress, such as exposure to toxic substances or the induction of diabetes, vitamin E supplementation was shown to significantly lower markers of oxidative damage in kidney tissues. This reduction in oxidative stress was often accompanied by a decrease in lipid peroxidation, a process where free radicals attack the fats in cell membranes, leading to cell damage. By mitigating this process, vitamin E helped preserve the integrity and function of kidney cells. Moreover, animal studies have demonstrated that vitamin E can improve overall kidney function in models of chronic kidney disease, CKD, or acute kidney injury. In these studies, animals treated with vitamin E showed improvements in key indicators of kidney function, such as glomerular filtration rate, GFR, and serum creatinine levels, compared to those that did not receive the supplement. For example, in a study involving diabetic rats, which commonly develop kidney disease similar to diabetic nephropathy in humans, vitamin E supplementation was found to improve kidney function by reducing proteinuria, excess protein in the urine, and preventing the decline in GFR. These improvements were attributed to vitamin E's ability to neutralize free radicals and reduce inflammation within the kidneys. Another aspect highlighted in animal studies is the protective effect of vitamin E against drug-induced kidney damage. Certain medications, while effective for treating specific conditions, can have nephrotoxic side effects, leading to kidney injury. In animal models where such drugs were administered, vitamin E was often able to mitigate the extent of kidney damage by protecting renal cells from oxidative stress and inflammation. This suggests a potential role for vitamin E in clinical settings where patients are at risk of drug-induced kidney injury. Overall, these animal studies support the hypothesis that vitamin E, through its antioxidant and anti-inflammatory properties, can play a protective role in kidney health. While these findings are promising, it is important to recognize that results from animal studies do not always translate directly to humans. Nonetheless, the positive outcomes observed in these studies have paved the way for further research, including clinical trials in humans, to explore the therapeutic potential of vitamin E in preventing and managing kidney disease. Human clinical trials have provided important insights into the potential benefits of vitamin E supplementation for kidney health, particularly in patients with chronic kidney disease, CKD, or those at risk of kidney damage. These studies have explored various aspects of kidney function, including improvements in glomerular filtration rate, GFR, reduction in proteinuria, and overall markers of kidney health. One of the key findings from human trials is the effect of vitamin E on reducing proteinuria, which is the presence of excess protein in the urine and a common sign of kidney damage. In patients with conditions like diabetic nephropathy, a leading cause of CKD, vitamin E supplementation has been shown to significantly reduce proteinuria levels. For instance, in clinical trials involving diabetic patients, those who received vitamin E experienced a noticeable decrease in urinary protein levels compared to those who did not receive the supplement. This reduction in proteinuria is important because it indicates a lower degree of kidney damage and a slower progression of kidney disease. Additionally, some trials have investigated the impact of vitamin E on glomerular filtration rate, GFR, a crucial measure of how well the kidneys are filtering blood. In these studies, vitamin E supplementation has been associated with either stabilization or slight improvements in GFR, particularly in patients with early-stage CKD. By helping to maintain or improve GFR, vitamin E may contribute to preserving kidney function over time, potentially delaying the progression to more advanced stages of kidney disease. Another important area of research has been the overall improvement in kidney health markers. Several trials have reported that patients taking vitamin E supplements showed improvements in various biochemical parameters associated with kidney function, including reduced levels of oxidative stress markers and inflammatory cytokines. These improvements suggest that vitamin E not only helps in managing oxidative damage, but also in reducing the inflammation that often accompanies kidney disease. In certain studies, vitamin E has also been investigated as part of combination therapy with other antioxidants or medications. These trials have explored whether vitamin E can enhance the effects of other treatments, with some positive results indicating that vitamin E may work synergistically with other compounds to improve kidney outcomes. However, it is important to note that while many studies show promising results, the evidence is not yet conclusive. The outcomes of clinical trials have sometimes been mixed, with some studies showing significant benefits and others showing more modest or no effects. Factors such as differences in study design, the stage of kidney disease in participants, dosage, and duration of supplementation can all influence the results. As such, more large-scale, long-term studies are needed to fully establish the role of vitamin E in kidney health and to determine the optimal dosage and treatment protocols. Overall, the findings from human clinical trials suggest that vitamin E holds potential as a supportive therapy in managing kidney disease, particularly in reducing proteinuria and protecting against oxidative stress and inflammation. However, patients considering vitamin E supplementation should do so under the guidance of a healthcare provider, as individual responses to treatment can vary and high doses of vitamin E may have adverse effects, especially in certain populations. Despite the promising findings from some studies on the effects of vitamin E on kidney health, there are significant limitations and controversies in the current body of research that need to be addressed. One of the primary limitations is the small sample sizes used in many clinical trials. Studies with limited participant numbers may not provide a comprehensive understanding of vitamin E's effects across diverse populations, and their results may not be generalizable. This limitation makes it difficult to draw definitive conclusions about the efficacy of vitamin E supplementation for the broader population, particularly for those with varying stages of kidney disease or different underlying health conditions. Another critical limitation is the short duration of many of these studies. Kidney disease often progresses slowly, and the potential benefits of a nutrient like vitamin E might require a long-term commitment to be fully realized. Short-term studies, typically lasting a few weeks to months, may not capture the long-term effects of vitamin E supplementation on kidney function or its ability to prevent the progression of chronic kidney disease, CKD. As a result, while some studies report improvements in kidney health markers, it remains uncertain whether these effects are sustainable over the long term, or if they can significantly impact the progression of kidney disease. The research on vitamin E and kidney health also faces the challenge of conflicting results. While some studies show clear benefits of vitamin E supplementation, others report minimal or no effects. These discrepancies can arise from various factors, including differences in study design, the specific forms and doses of vitamin E used, the health status of participants, and the presence of other underlying conditions. For example, the effectiveness of vitamin E might differ depending on whether it is used as a standalone treatment or in combination with other antioxidants or medications. The variability in findings adds complexity to the interpretation of the data and highlights the need for more standardized and rigorous research protocols. A significant controversy in the field is whether vitamin E supplementation alone is sufficient to reverse kidney damage. While vitamin E's antioxidant and anti-inflammatory properties suggest it could play a protective role, the idea that it can fully reverse kidney damage remains contentious. The complexity of kidney disease, which often involves multiple contributing factors such as diabetes, hypertension, and chronic inflammation, suggests that a single nutrient may not be able to address all aspects of the condition. Moreover, kidney damage, especially in its advanced stages, may involve structural changes to kidney tissue that are beyond the reparative capabilities of vitamin E alone. This has led some experts to argue that while vitamin E might be beneficial as part of a broader therapeutic approach, it should not be relied upon as a standalone treatment for reversing kidney damage. Overall, the limitations and controversies in the current research underscore the need for more comprehensive long-term studies with larger and more diverse populations. Such research would help clarify the true potential of vitamin E in kidney health and determine its appropriate role within a broader treatment strategy for kidney disease. Until then, while vitamin E may offer some benefits, it should be considered as part of a holistic approach to kidney health rather than a singular solution. When considering vitamin E supplementation for kidney health, it is essential to approach it with a clear understanding of the recommended dosage, potential risks, and whether it is appropriate for specific individuals. Based on current research and expert recommendations, the safe and effective dosage of vitamin E for adults generally ranges from 15 to 400 IU per day, with the most common recommendation being around 15 IU, 22.4 milligrams per day, which aligns with the daily value set by health authorities. However, in some clinical studies investigating the effects of vitamin E on kidney health, higher doses have been used, often between 200 to 400 IU per day. It's important to note that while these higher doses may be beneficial in certain controlled settings, they should be approached cautiously, and it is advisable to consult with a healthcare provider to determine the appropriate dosage for individual needs. Potential risks and side effects associated with vitamin E supplementation, particularly at high doses, should not be overlooked. One of the most well-documented risks is an increased likelihood of bleeding. Vitamin E has anticoagulant properties, meaning it can interfere with blood clotting. This effect is particularly concerning for individuals taking blood-thinning medications such as warfarin or aspirin, as it could exacerbate the risk of bleeding. High doses of vitamin E, especially those exceeding 400 IU per day, have also been linked to other adverse effects, including nausea, diarrhea, stomach cramps, fatigue, and even an increased risk of hemorrhagic stroke in some studies. Therefore, it is crucial to adhere to recommended dosages and to be aware of these potential side effects, particularly in populations at risk. Individuals who might benefit from vitamin E supplementation for kidney health include those with early-stage chronic kidney disease, CKD, as they may still have the potential to prevent further progression of the disease through antioxidant support. Additionally, individuals at higher risk of oxidative stress, such as those with diabetes, hypertension, or a family history of kidney disease, may also consider vitamin E as part of a preventative strategy. For these individuals, vitamin E could help mitigate the oxidative damage that contributes to kidney deterioration. However, supplementation should be tailored to each person's specific health profile, considering factors such as their overall antioxidant intake, underlying health conditions, and current medications. Interactions with other treatments are another important consideration when using vitamin E, particularly for those already managing kidney disease with medications. Vitamin E's anticoagulant properties can interact with blood-thinning medications, potentially increasing the risk of bleeding. Additionally, vitamin E might interact with certain chemotherapy drugs, immunosuppressants, and medications used to manage cholesterol levels, potentially altering their effectiveness. Given these potential interactions, it is strongly recommended that individuals consult with their healthcare provider before starting vitamin E supplementation. This consultation is especially crucial for those already on medication regimens or undergoing treatment for chronic conditions, as it will help ensure that vitamin E is used safely and effectively in conjunction with other therapies. In summary, while vitamin E offers potential benefits for kidney health, its use should be approached thoughtfully and with proper guidance. Safe dosage, awareness of potential risks, and consideration of individual health circumstances are all essential factors in making an informed decision about vitamin E supplementation. Vitamin E holds promise as a valuable nutrient for kidney health, primarily due to its potent antioxidant and anti-inflammatory properties. By neutralizing free radicals, vitamin E helps protect the delicate cells in the kidneys from oxidative damage, a key factor in the progression of kidney disease. Its ability to reduce inflammation further supports kidney health, potentially slowing the progression of conditions like chronic kidney disease, CKD. Clinical studies, although varied in their outcomes, suggest that vitamin E supplementation may help improve markers of kidney function, such as reducing proteinuria and maintaining glomerular filtration rate, GFR. However, it's important to approach these findings with caution. While the potential benefits of vitamin E are encouraging, it is essential to recognize that the current body of research has its limitations, including small sample sizes, short study durations, and sometimes conflicting results. Additionally, the idea that vitamin E alone could reverse kidney damage remains a topic of debate. Kidney disease is complex and often requires a multifaceted approach that includes diet, medication, and lifestyle changes. Vitamin E should be considered as part of a broader strategy for kidney health rather than a standalone cure. Given these nuances, it's crucial for individuals interested in vitamin E supplementation to consult with their healthcare provider. Professional guidance ensures that supplementation is appropriate for their specific health needs and avoids potential risks, such as interactions with other medications. Additionally, exploring natural ways to support kidney health, such as maintaining a balanced diet rich in other antioxidants, staying hydrated, and managing blood pressure, is equally important. For those interested in delving deeper into the subject, there are numerous resources available. Further reading might include scientific studies on the role of antioxidants in kidney health, articles detailing the effects of vitamin E on chronic conditions, and books on nutritional approaches to kidney care. Related topics that viewers may find helpful include content on top nutrients for supporting kidney function and how antioxidant vitamins can protect and heal your kidneys. These resources can provide a more comprehensive understanding of the role of nutrition in maintaining healthy kidneys and offer additional strategies for supporting overall renal health.